Belly fat is one of the most important factor in the causation of prediabetes or insulin resistance, because belly fat, they are not inert fat, they secrete various substances, basically various inflammatory cytokines, which causes insulin resistance, which causes that insulin becomes less responsive, the insulin receptor becomes less responsive to insulin, and thereby the insulin do not act properly, and thereby it leads on to insulin resistance. So belly fat is one of the most important risk factors, especially in Indian subcontinental standard, where belly fat is very prevalent, and presence of belly fat, waist circumference of more than 90 centimeter in case of male and more than 80 centimeter in case of female is an indicator the person is having a pre-diabetes and will progress into diabetes or other complication of diabetes if it is belly fat is not taken into consideration. So belly fat is something which is very, very important. So which all persons are a risk factor for developing pre-diabetes? As we have discussed, belly fat is one of the most important risk factor to develop insulin resistance or pre-diabetes. Along with the belly fat, age is also very important risk factor. As we age, we tend to develop more and more insulin resistant. That means our body become less and less insulin sensitive. So age is one of the risk factor. Belly fat is a risk factor. Family history. If you have family history of diabetes or pre-diabetes, you have a higher risk factor. Sedentary lifestyles and gestational diabetes, those who have developed diabetes in the pregnancy also is a risk factor. Along with that, PCOS, polycystic ovarian syndrome in case of females also, these are also risk factor for developing a pre-diabetes or frank diabetes later on. So these are the risk factor for developing pre-diabetes. So what is the harm? Why you are talking about pre-diabetes? Because it's not a diabetic, frank diabetes, but pre-diabetes also can lead on to various complications. Especially it can lead on to kidney complications, it can lead on to fatty liver disease, it can cause various nerve complications, it can lead on to eye complications. Because although pre-diabetes, the sugar levels are not very high, but pre-diabetes, our insulin level in the blood is very high, and insulin causes inflammation in the body. Insulin causes endothelial dysfunction. Like endothelium is the inner lining of the blood vessels. So insulin causes dysfunction in the blood vessels. Thereby blood vessels become rigid and there is inflammation in the blood vessels. So thereby there causes blockages of the small blood vessels in the eye, in the kidneys, and in other organs of the body, thereby leading on to various organ dysfunction. So even before the frank diabetes has set in, pre-diabetes can lead on to all these complications. So not only pre-diabetes can cause all these complications, pre-diabetes also can lead on to cardiac complication, heart attack or stroke, because of endothelial dysfunction, because of glycation, because of inflammation, where they damage the blood vessels. The blood vessels normally are very pliable, they are like a rubber pipe, they are quite elastic, but because of pre-diabetes condition, the rubber pipe becomes rigid, becomes more like a lead pipe. So blood vessels become rigid, patient become hypertensive, and they develop damage to the inner layer of the blood vessels, thereby they develop blockages in the heart arteries as well, leading on to heart disease or stroke. So pre-diabetes leads on to heart disease, heart attack and stroke even before they develop a frank diabetes.